Okay. I want to thank you guys for participating in the discussion and everything and asking questions, because it helps a lot when you have to present. If people will ask the questions, because you can see on their face that questions are going on inside their heads, but they're not going to ask out loud. So I just want to tell y'all how much I appreciate that. I'm not going to, because everything that they presented is right here in this section that we just, this is the third section, some basics about disabilities. I do want to read these two, this front page to you, or at least have you take a look at it. It talks about an estimated 48.9 million people, or 19.4% of the non-institutionalized civilians have a disability. That's a huge number that, like they were saying. Huh?
That's hard to believe.
I know, but when you look at it, and this is from a 1994 census, that's not even what it is now.
Oh, wow.
This was in 1994 that this census looked like that. It also says that 24.1 million people have a severe disability. And an estimated 34.2 million people, or 17.5%, have a functional limitation. And they explained that to you, that that's the disability that you can see on the outside. Or a disability that's profound enough that keeps them from being able to function in the workplace or out in the community. And this is as defined in the 1994 Census Survey. A person with a severe disability is one who is unable to perform one or more activities of daily living. And we talked about that. Those are the ADLs. And that's like activities of daily living is brushing their own teeth, brushing their hair. That might even include being able to hold down a job, or being able to understand simple instructions. As defined in the 1994 Census Survey, a person with a non-severe disability is one who has difficulty performing functional activities such as hearing, seeing, having one's speech understood, lifting, carrying, climbing stairs, and walking, or has difficulty with activities of daily living, which is also, these are opposite ends of the spectrum on this. I think I'm on this spectrum because I have a hard time with my checkbook. So, I'm just saying. And we did talk about disability etiquette when we have our daily interactions with people. First, when talking about someone with a disability, always identify the person first. That's what they meant when they said person first speech, rather than the disability first. Instead of saying wheelchair bound person, you say this person uses a wheelchair to get around, or it takes a little bit longer. And I think after having looked at it quite a bit, I see a pattern of the reason that people have done this is out of laziness, kind of, because we want to shorten the label that we put on somebody. You know, she's blind, he's deaf, he's, you know, whatever the visible disabilities are. Or they're just crazy because they don't understand what that person's cognitive disability may be, because they're listed under an IDD diagnosis. When you use the person first language, as I said before, you always list the person first and then whatever their disability is, unless you just call them by their name. You know. Second, be sensitive. And that was the thing that I think they were talking about. They just want to be treated like anybody else. They just want for people to know that they're not suffering, they're not afflicted, they're not a cripple, they're not a victim of. They're just living with what's going on, just like we live with high blood pressure, or we live with sugar issues, or we live with eyeglasses because our eyes don't work as well as someone else's does. Doesn't mean we're a victim of sight impairment. It just means we wear glasses. And when somebody introduces me, usually if they introduce me, they don't say, that's Tina, she wears glasses. They say, that's Tina, she's crazy, she has pink hair.
I can see that.
Yes. Okay. And then on the next page, you're going to see this little dude up here, because this is me, sort of. I was sitting in someone's office probably about a year and a half ago, and I thought that I was being very careful about the way that I was saying things. And this person explained to me that I was being disrespectful to others with handicaps. And I was like, what? Because I grew up in the age where we didn't say they're retarded. We had other terminology. Well, that other terminology is no longer acceptable. Now there are any number of ways of saying what needs to be said without putting too fine a point on it, so to speak. Communication skills are vital in developing relationships with people with and without disabilities. And one of the things that I wanted to stick in here has to do with that sensitivity. If we just treat each other like people, if we don't stare at the wart on the end of someone's nose, if we just look at them, because, and I'm using that just as like a silly example, if we just look at people like they're people. I mean, my wart is on the front of my
I
head.
like that down there. It says, what happened to you?
Yeah.
Oh my gosh. That would be bad.
You'd be surprised at how many people will say things like that because they don't understand how hurtful it is. They're not trying to be mean. They're not trying to,
They're ignorant.
yes, not stupid,
No, just
ignorant. Yeah. This is the page that I wanted you guys to take a real close look at, where it says disability etiquette. And it talks about treat adults as adults. That's one of the reasons when Renee was talking that I wanted him to clarify what he meant when he said make your speech fit the person. I don't think that that's exactly the way he said it, but it could have been misconstrued as talking down to someone if you hadn't already had an education to teach you not to speak to someone.
Well, if someone has a cognitive ability to be spoken to as an adult, you're going to talk to them like that.
Yes.
But even though they may be 50 years old and they have the cognitive ability of a 12-year-old, that's how you need to talk to them.
Right, right. And that's why they tell us when we're in training, you always treat an adult as an adult. They have their rights. They have the right to make their own decisions. If you don't agree with them, you don't say, now, Johnny. You give them reasons for why it's not beneficial for them to do things. And then if that doesn't work, then in our case, then we speak to the caregiver. But we don't try to boss. We don't try to order them around. We don't try to tell them things like that. Now, if they're putting themselves in danger, that's a whole different story. You're going to have to intervene, especially if you're the only person there. Like, if they have the cognitive ability of a 3-year-old and you see them headed out the door, you might want to redirect them gently and bring them back to do something else, something that would not put them in a dangerous situation. But you're not going to say to them, Mommy said no. You're going to say, no, how about we go do this? Would you like to, let's play cards, something of that sort of thing. But always be respectful, always treat them as if they understand the exact same thing that you do until you know different. Always respect the person's dignity, their individuality, and their desire for independence. Because everybody wants to be independent, even when they are 3 years old. They want to be independent. And you want them to learn to be independent. You just got to make sure they don't hurt themselves in the meantime, if at all possible. Refer to adults with a disability in the same way that you would refer to any other adult. This is Jim. Not, this is Jim, he's retarded. That's probably not going to be in anybody's best interest. Never assume you know what assistance, if any, a person with a disability requires. Remember a couple of times back we had that don't assume, that was the first one. Always ask. Once again we're saying don't assume that you know what they're needing, especially if they can't communicate to you with verbal cues.
That's really hard.
Yes, it is. But that's why you want to go beforehand and kind of get to know the family a little bit. And the caregiver is usually going to give you the things to look for. Like, I used to work with a lady that she couldn't tell you she was thirsty or hungry. But thirsty was here on the side of her mouth, and hungry was here in the front of her mouth. And her caregiver is the one that had to tell me that. Because I thought, she's thinking? Because I do that sometimes. I tap my chin when I'm thinking. And so I couldn't figure out what it was that she needed. The family will usually tell you if they have cues that they need to tell you.
And I think why Esther covered it very well in the fact of the communication, because pure and simple, I think the best thing that's ever happened to me in my life is being able to go in and do, I worked in a dental clinic and did dental desensitization, and so they're with nonverbal individuals. And everything of our communication was nonverbal. And so for months on end, I literally treated clients with no normal, what we would call communication, and it became that every little nuance, and if anything, sometimes I may become too annoying asking every little cue a person may make, because you read every cue, every eye movement, every jerk of the lip, shoulder shoulders, things like that, because a person can tell you a whole lot without opening their mouth.
And that's called hypervigilance. And when you work in an institution or with a people group, you may see that quite a bit. Or you may see that with someone that has a family member that is nonverbal. There are other reasons that you will see it, but more than likely, these are the instances that you're going to see them. And you may see someone jump up and run, go take care of something right quick, and you're like, what just happened? But their loved one gave them a visible cue rather than a verbal cue. They knew what that cue meant, and they were off and gone to go get them what it was that they needed.
My daddy looked at his tea glass and Mother went and got tea.
My dad would go, and somehow my mother was able to decipher what.
And that was sweet of her, because usually when people go about needing to fill a glass, I usually go.
Well,
I always thought
Kitchen's over there.
Mother should have told Daddy to get up and get some.
That's what I was saying. I think mine would have been the kitchen's over there.
your legs painted on. I tried that just once with my mom. And I actually even pointed to give her more of a verbal cue, because she was pouring something into my dad's, and she looked at me and she said,
Your mom's actually.
and I was like, can I have some? And she went, you have verbal skills. I just love you, Mom. It's good. It's good. One of the things that you're going to always want to do is you're gonna wanna speak directly to the person with the disability, not to their companion about them. Cause doesn't it just, make you aggravated when somebody comes up and talks to you about Ronnie when Ronnie's standing right there next to you?
Mhm.
And you wanna go,
I just kinda go,
he has lips,
here, speak. I'm not gonna
you
talk
know,
more.
or when someone talks about you to someone else and asks a question of the other person and you're like, what am I, chopped liver? I'm standing right here. And that's us that can say to them, why would you do that?
Mhm.
And if this happens to us, how much more is it gonna happen to someone that, quote, appears to have a disability? Like I was just adding in there, and I had this happen to me recently and I felt so bad. I was like, I couldn't get what was happening. I'm easily distracted, and so when someone has a deaf interpreter with them and they're standing on two separate sides of me, I play ping pong. Like this. You're supposed to look at the person that you're talking to. You're not reading the sign. You're speaking to that person. They can hear you, and they're signing to the deaf person. But I was doing this, and finally the interpreter reached out and she touched me and she said, I can hear you just fine. And you're not reading my sign language, so you can look at her. I felt like I was about this big. She was very kind. But I just went, I'm fixing to go teach a class on this, and I'm doing the very thing that I'm gonna tell everybody not to do. But it's very easy for it to happen, so you kinda have to be pretty deliberate about it when you're first getting started. Never speak about the person as if they are invisible, as if they can't understand what is being said, or that they can't speak for themselves. Do not put people with a disability on a pedestal or talk to them in patronizing terms as if they're performing normal everyday activities were exceptional. And those are the things that I wanted you to know. So, I'd kind of like to know what you guys thought of the presentation this evening. How you felt about what do you, how, do
I
you think
learned a
this
lot.
is?
I learned a lot.
Okay,
I mean, personally, I've never had a person that was blind actually talk to me about how they felt about being approached or their animal. And I was totally ignorant about that myself.
hello. I think we all are, and I think we need to cut each other a break and just learn
Yeah.
from our mistakes.
Right,
You
right.
know.
I mean, if you don't know, you don't know, and you just do the best you can, but that was very helpful.
Well, I don't know if y'all noticed, but when Michelle came in and she sat down and Tabor was there, I stepped up close to her and I said, Michelle, can I visit with Tabor, or would you prefer that I
I
not?
heard you do that.
There was a real good reason for that, because I didn't want anybody else to approach her dog without knowing that that when she's in the harness, it's not okay. And so, and she, as she was going by, she went, good job. I was like, okay. So,
It was, I mean, yeah, because all of us, I mean, when you see a dog, you want to go over
Oh,
there,
yeah,
hi,
it's
hey,
like a little
you know.
kid.
And it's good to know that, okay, she's busy, she's in the working mode, so stay away. I had no idea.
Little Rock, Arkansas, I went to, I went there for a week where the Lions Club trains people,
Oh,
Lions Moral Services for the
yes.
blind.
Mhm,
And they don't use leader dogs at all, they use just the white cane.
mhm.
And they train those people to the point that they can cook for themselves, roost their clothes, make all that stuff. And the test to see when they graduate is they take them downtown, drop them out with their white cane, and they're supposed to get back to the place where their school is.
Wow.
And they have somebody watching them,
Well,
but
sure.
that's still a struggle, you don't know. I mean, they can't see
Well, it's
anything.
one thing to be in a controlled environment.
Yeah,
Where it's kind of the same thing all the time.
right,
But then to go to a strange place,
and take him, dump
my
you out.
heart,
and
my
everything.
heart would be beating.
Sure. But you pick up a lot of respect
I'm
for
gonna fall on my
what
face.
people can do.
Absolutely. It takes
I
a
mean,
lot-
I can see
I
if you drop me
admire
off in
them.
the middle of town
It
somewhere, I
takes
don't
With
a
the
know.
white stick.
It takes a lot of courage. I
Mhm.
admire all of them.
But they've had a lot of training at that point,
Sure.
you know,
Mhm.
as to how to deal with it.
Hmm.
And isn't it funny, and I want you to understand that I'm not saying anything against what you just said. But you said, I admire them because they're so brave. But that's kind of like saying, oh my gosh, they were able to do something that everybody else could do. And I don't mean, I want you to
I mean it
understand.
in that instead of having a pity party, saying, oh,
Mhm.
poor me, that they have,
Pulled
stood
themselves up
they're
and
pulled
gone on.
themselves up and going, I don't care if I have this to deal with, I'm gonna do something,
Mhm.
just, like Casey said, just
Just
try to
tell me I
can't
can't.
do it and I will.
Yeah.
At the same token, I admired Casey for staying in the wheelchair instead of just taking the scooter.
Mhm.
But I
Right,
mean,
absolutely.
I don't think he resented that. It's how you present it that
Right.
makes the difference.
Mhm.
Right.
Well, the reason that I said that is because I was gonna equate this to speaking to caregivers.
Mm.
When I was a caregiver for my mother, it used to make me so embarrassed because people would say, I so admire what you've done for your mother.
Mm.
And I think a lot of times caregivers don't view, it's kind of like
Mm.
people with quote disabilities, they don't view it like that. They don't view
Yeah.
it as in, I
Right.
did something extraordinary. They view it as in, it just is what it is, you know.
I know, but it makes me feel like, gosh, all the time I've whined about something and good grief. I don't have all those setbacks.
I understand, I hear what you're
Puts
saying.
things in perspective.
Yes, it does. Puts things into big perspective. I just would like us all to, also to remember, when dealing with caregivers, that in a way, it's kind of like that.
Right. Well, it's just like, I admire you for loving your mother. Well, hey, it's kinda-
Most near everybody loves their mother.
what are you supposed to do? Stick her someplace?
But some people would.
I know,
Sharon.
but, yeah, I know where you're coming from there.
Okay. For me, it was, I have a family member that I absolutely adore.
Mhm.
He makes me feel 10 foot tall and bulletproof. But there's one thing that he does that it was like if he could have stuck something in me and walked around, it wouldn't have hurt anymore. And he had no idea because he thought he was telling me or reinforcing what I was doing.
Mm.
Because in one sentence he would say, we love you and your mama. You're our family. We'll do anything we can to help you. But it's obvious that you don't need our help because you do it all. I mean, you got it all under control.
Mm.
And he didn't mean that
Yeah.
as in, we're not gonna help you because you won't let us, because you have to do it all. He was trying to say to me that he admired
Yeah.
what we were doing, but it was
Even my
hard.
siblings, after Mama passed, or even while she was still here, and I was the one that lived the closest, so I did a lot. They, it was just a long ways for them to come and different things like that. And I said, we appreciate you, sis, for everything you're doing. And I said, hey, I'm the one that has the privilege of being here. And that was my perspective of it. So I'm the one that gets to. I don't think about it as being a burden.
Mhm.
Get into it.
I mean, all the time I spent, those were precious moments
They
that I
didn't-
got to have,
That they didn't
that
get.
they would have liked to, but they didn't. They weren't here close.
Well, I think this evening has been a tremendous success from my viewpoint. I've seen some really good presentations from some folks that made themselves very, very clear
They did a good job.
about their belief system and how they want to be treated and how they want to see us treat other people. And I really appreciate that you guys asked questions and did the things that most classroom folks do. I realize that I can be really dry and because I'm just trying to get the information out there. But I really did appreciate the fact that you guys didn't have to listen to me tell you all that. You got it from a perspective that
They were each one very passionate about what they do.
very
Yes.
much so, very
That
much so.
meant, that meant a lot.
Yes.
Yeah. Well, y'all, I will know next Monday or Tuesday whether or not we will be able to have CPR class also.
Okay.
Next
when we come
week.
Next Thursday.
And I will tell you that next week's gonna be very short and sweet, because next week is pretty much the very end. I'm gonna tell you a little bit about legalities, and you have your notebooks, you can look through what's already there.
Okay.
And we're also gonna talk about the homework that I gave you guys this last week,
Okay.
about where you think that fits in with you and how you fit into the community. You know, how can that help you, knowing those things about yourself, how can that help you fit in to a quote volunteer place in the community? And hopefully, I will have information about when and where for the CPR training, and if I can get it here next week, I'll do my best to get it here this next week.
Okay.
And if we can get that done, then you guys will be done and you'll be off and running.
Okay.
So, and you could probably even, I mean, you could probably already start, but I want to give you your certificates of completion, and I want to get, you know, I want us to do this the way that Dad's wants us to do it. But you guys already have pretty much all the functional information that you need to get things done. According to that clock, it is 20 minutes till 9. So we are 10 minutes late. So I'm letting you guys go. Thanks so much, guys.
Thank you.
Would you mind helping me put these tables back?